Hey guys, today we're going to talk about arthritis, the joint destroyer. We're going to learn about what it is, what causes it, and some ways to treat it. So let's get into it. What's up guys? Aaron Kasner, Doctor of Physical Therapy. Today we're going to get into the nitty gritty of arthritis. So what is arthritis? It literally translates into joint inflammation. But what's causing the inflammation? What's causing that knee or hip to be irritated? Well, it all comes down to cartilage. We have cartilage and it protects the ends of our bones. It helps keep frictionless movement. It helps keep shock absorption there. And it just keeps things running smoothly overall. All right, it's a good protectant on the end of the bone and therefore protects the joint. But as that cartilage wears down, the bone becomes exposed. And that's when the inflammation kicks in. The areas of the bone that shouldn't be exposed become wore down and end up getting irritated by the pressure between the two joints, between the two bones, I should say. And that's what leads to the inflammation. That's what leads to the pain and the swelling. And anytime you start to move and load that joint, that exposed bone becomes more and more irritated. That cartilage can wear down and spread, making the inflammation worse. Okay? So, what are some things that we can do to prevent that cartilage from being damaged and prevent arthritis? The number one thing is watching our weight. So that could be healthy weight or unhealthy weight. Healthy weight meaning if you're really muscly, if you're really strong, and you're just a bigger person, you're going to load your joints a little bit more. And you can't really help that, I understand. So you got to make sure that you're doing other things right. It's making sure you're not putting on excessive weight, even though you have a lot of muscle mass. All right. Those of us that maybe have a little bit of unhealthy weight, way more than what we probably should, that's healthy for us, we're also loading our joints a little too much. When we load our joints like that, we're compressing down and we can move in certain directions that causes that cartilage to wear down in certain spots. And once that bone becomes exposed, it can kind of spread because it gets weaker around that area. Okay, so we need to watch our weight. So exercise and dieting. Now, if you already have arthritis, exercising can be a little bit tough. But we'll get to that in a little bit later on in the video to talk about what are some things that you can do even though you're having pain in certain joints. A couple other things that causes arthritis, and two things that we don't have a ton of control over. One is genetics. So if your parents had arthritis or your grandparents have arthritis, you may have a higher likelihood of having it yourself. Now, that doesn't mean you're destined to have it. So don't start worrying, well, oh no, my grandma had it, my mom has it, I'm destined to have it. Maybe you might have it, but you may not, okay? Still treat your body right. Give yourself the best fighting chance by trying to stay in a healthy weight range and exercising, lubricating your joints, allowing yourself to move in a pain-free way, okay? And then the other one is age. As we get older, degeneration is a part of life, okay? Our cartilage is going to wear down. It's going to degenerate. Now, if we've had injuries or if we've had issues with the cartilage in the past, then we're even more likely to have issues with arthritis, but we're not destined to. Okay. And the last thing is an injury or an accident. So if you've been in a car accident, maybe you were sitting shotgun and your legs were extended and you rear-ended somebody, then your knee, let's use your knee for example, came together in a really powerful force and it almost crushed it down. Okay, that can damage your cartilage too, and you can have chips of it and breaks off of that cartilage in your joint, and that can be an issue. That's pretty rare, but that can happen, okay? So that may be a starting point for having arthritis. So if you've been in an accident, you've had issues with your loading joints, so your ankles, knees, or your hips, then make sure that you're watching your weight. Make sure you're still exercising in a non-painful way in order to reduce the risk of it becoming arthritis and becoming inflamed in that joint space itself, okay? Now, if you already have arthritis or you know you have arthritis and you're trying your best to try to treat it, let me give you some options that you can do to work on that. So, still exercising, right? Still keeping that weight down, doing your best. Now, I know I have arthritis in my knees, Aaron. How can I go and exercise if it hurts every time I walk or anytime I do an exercise? I hear you and I understand. So, don't get out and push through the pain. I don't want you to do that. But there are some things that you can do in order to work on exercising without loading your joints. The number one thing is swimming. So getting into a pool, allowing your body to kind of float eases your joints. Plus it keeps you moving, right? Swimming can be very, very hard on the body in a good way. It allows you to get stronger, allows you to increase your cardiovascular system, gets your heart pumping in a healthy way. So swimming is the number one thing you're going to like if you are having problems with joint arthritis, or joint pain and arthritis, I should say. Okay, so that's number one. But you can do other things too. So if your knees bother you, then maybe don't do any exercises that causes you to stand. Okay, there's plenty of machines you can use. You can do a bike because that's not really loading your joint as much. You can try the elliptical. Some people like that. Some people feel like it's too much. That's okay. See what you can tolerate. And if you can tolerate it, it's not pain with it, then you can do it. Don't worry about making it worse. If it's not causing pain with arthritis, then you're not causing any kind of damage. Okay, so get after it, try to keep exercising and keep your diet in check, try to get that weight down. So if you go and you see your primary care, they're going to tell you to take an anti-inflammatory. So going and taking ibuprofen or Aleve, something like that, because that's going to reduce the inflammation in your joint. Now this is all good. I think that's okay for you to do, but that's not going to make things better. You're still going to have the arthritis, you're still going to have inflammation. It's going to reduce your pain. So the best thing you can do is do that, but stay active. Try to unload that joint a little bit more, okay? Try to prevent having to go to surgery. Some quick fixes you can do is throwing ice on it. So the nerve endings are really, really sensitive in that area because that bone is exposed. So you got to get those nerve endings to calm down. One of the best ways to do it is throwing ice. Okay, ice reduces the blood flow to those nerve endings, so they're not quite as sensitive, so it allows you to be able to tolerate more. Now, kind of like with the medicine and taking ibuprofen, it's not going to cure anything. It's not going to make anything go away completely. But if you know you're going to have a long day, or you know that you got to get stuff done, you may throw ice and take some ibuprofen to try to get you through. So if you go and see an orthopedic surgeon for arthritis, they're going to give you a few options. One's going to be surgery. You can get your joint replaced. Okay, that's a pretty big surgery. So I would say really think about it before you go into it. And they're going to want you to think about it too. Okay, because the life of a prosthetic is roughly 20 years. So if you're young, if you're in your 30s or 40s, you may have to have a revision, have another total knee done in the future if that prosthetic wears out. Okay, so you want to delay as long as you can, but if you're having issues and it needs to be done, it needs to be done. Okay, so having your joint replaced is probably going to be the biggest thing that you can do and create the biggest change, but it may not be the best depending on where you are in your situation. The second thing they'll tell you is they can give you a steroid injection, okay, cortisone injection. That can help reduce the inflammation as well. For some people, that works for maybe a few days. Other people, it lasts for months. So you could be one of those lucky ones where it really works for you and allows you to get through your days and allows you to be pain-free and be able to exercise and be able to do the things you want to do for a longer period of time. And then the third thing is physical therapy. Okay, what I think is best if you're really having problems with arthritis is coupling two together. So having the injection and then going to PT. So with physical therapy, we can give you exercises that can be pretty non-painful for you. And we can do certain things. We can do passive range of motion. We can do joint mobilizations. We can do some what we call joint distraction. So it's kind of opening up that joint space, giving you some relief. Okay, so those two things are probably the best thing that you can do to put off getting a joint replacement. Okay. Now, you may never need a joint replacement if you can keep it within a range that's tolerable for you. But if that pain gets too much and you can't do your day-to-day things, you can't live your life, maybe you really should consider having surgery or talking to a trusted orthopedic surgeon. Okay? So that's all I have for you guys today. If you liked what you saw, click the like button, hit subscribe, hit that notification bell. Check out my other videos. If you want to learn more about pain or I'm going to have more to come when it comes to knee replacements and hip replacements and the exercises that you can do and just more information on it, then click subscribe and check out my playlist, check out my channel. If there's anything that you want to learn about that I haven't talked about yet, click in the comments. Let me know what you want to learn about and I'll make a video for you. All right, thanks for tuning in, guys. See you next time.